Understanding how diabetes progresses. The most common cause of type 2 diabetes is obesity-related, which generally follows a vicious cycle pattern. Diet high in calories, particularly if high in refined carbohydrates. Insulin levels in the bloodstream rise to cope with the high and quick-acting carb intake. Weight is gained around the belly, central or truncal obesity. Consistently high insulin levels lead to the body's cells becoming resistant to insulin and commonly led to weight gain. High insulin levels also increase weight gain. Insulin resistance leads to an increase in blood sugar levels, particularly after meals. The pancreas produces more insulin to cope with rising blood sugar levels. High sugar levels lead to feelings of lethargy, and high insulin levels lead to increased hunger. Hunger often leads to overeating and lethargy, with less physical activity being taken. Overeating, less activity, and high insulin levels all led to further weight gain and more insulin resistance. Consistently high demand on the pancreas to produce extra insulin leads to damage of the pancreas insulin-producing beta cells. Beta cell damage results in the body struggling to produce enough insulin, and steeper rises in blood sugar levels leads to more recognizable symptoms of diabetes, such as thirst and a frequent need to urinate.
How to fix your diabetes without metformin? Watch, link in the description.